Hi, this is Dr. Kannan Karpaya Kumar. I'm a consultant hand surgeon at Spire Clinic, Bangalore. I'm going to be talking a little bit about basics about adult brachial plexus injuries. This is just an information video for patients who are looking it up for the first time online or on YouTube. So, brachial plexus injuries are very common in India because of two-wheeler accidents. And brachial plexus is a group of intertwined nerves that arise from the spinal cord. They are responsible for sensation and movement of the whole of the upper limb. They are right behind the clavicle or the collarbone, and they generally tend to get injured quite easily. So the brachial plexus are divided into multiple different parts, including roots, trunks, divisions, cords, and they finally become the peripheral nerves. They can get injured at any level. The more higher the level, the more poor the prognosis or the more poor the outcome for the patient is. The more distal the level of injury, um, the outcome is better, or we can do something to improve their condition surgically or otherwise. Many or most of the injuries recover very quickly within months to weeks, but some do not recover, and the outcome may be dependent on surgical intervention. The mechanism of injury is most commonly when the head is stretched apart from the shoulder, which is very common in two-wheeler accidents. This can also happen in falls from a height, knife or gunshot wounds, which are not as common here. And of course, the most common 19 to 95% of the cases are because of motorcycle or two-wheeler accidents. So there are various types of this brachial plexus injuries. One could be an avulsion. Avulsion is where the tendon is pulled off, the nerve is pulled off from the spinal cord. The second type of injury could be just a stretching injury or called a neuropraxic injury. And third type is a rupture injury, where the nerve is just pulled apart from each other, just like a rope or a thread rubbing against a surface and getting damaged. So, the avulsion type of injury is one of the most severe types of brachial plexus injury. We may not be able to do direct repair, and we will have to do something called as nerve transfers or some other um, supplementary procedure to improve the outcomes. Ruptures can be treated with nerve graft or some kind of surgery. Upper trunk palsy, that is the most common type of brachial plexus injury which occurs with a two-wheeler accident. And here is where the patient usually loses the ability to lift the shoulder or bend or flex the elbow, that is, the biceps is affected. The other type of injury that can cause a lower trunk or the lower nerve injury is when a person falls from a height and hangs from a tree, which causes forcible injury to the lower trunk. In this case, the shoulder and elbow function is maintained but will lose the hand function. A panplexus injury is when all the nerves, that is C5 to T1, is involved. This has poor prognosis, and the patient has complete loss of activity in the upper limb, and we call this as a flail limb. So, what are the symptoms that the patient presents with? Usually, some amount of weakness in the upper limb along with the loss of sensation. The patient also has a lot of pain, which is called a neuropathic type of pain. So, typically, we wait for about 3 to 6 months um, before we decide to do any surgical intervention in these patients. And when a patient has a suspected brachial plexus injury, it is important to meet a hand surgeon or a brachial plexus surgeon as early as possible, get it evaluated, and make sure that there is progressive improvement in the movements. What are the investigations that we do once we see a patient with brachial plexus injury? One, we get an X-ray of the shoulder and the chest to make sure the bones are fine with no other fractures in the area. We also get an MRI done. MRI may not give us a complete picture, but it directs us towards the type of the injury that the patient might have suffered. We can also get electrodiagnostic studies like EMG and NCV to further delineate and understand the injury. Of course, clinical examination and surgical examination is the best way to understand the exact type of injury. However, MRI and electrodiagnostic studies direct us or help us in the management of these conditions. Most patients, 80 to 90% of these minor brachial plexus injuries, recover well and spontaneously. However, those that do not require some kind of intervention from our side. The time period that it takes to heal, the patient has to undergo physiotherapy to keep his muscles and joints supple so that when the recovery happens, he makes a complete recovery and can go back to his job. Surgical treatment is indicated around 3 to 6 months of period from the injury when we don't see any visible improvement or um, recovery in the muscles. So here we recommend either nerve grafting or nerve transfers or sometimes even free functioning muscle transfers. So this recovery discussion must be had with the hand surgeon, and then you should decide whether to go ahead with surgical intervention or it may be worthwhile to wait for some more time. So during surgical intervention, we make an incision above the collarbone and one below the collarbone to completely dissect the brachial plexus and look at the site of injury and try and repair it. This takes a long time. The surgery takes about 4 to 7 hours, and this requires microscope, loops, and fine instruments because the nerves are very fine structures and needs to be handled with care. If the nerve is cut or ruptured, we can repair the nerve with very fine sutures under the microscope. And if after preparing the nerve ends there is a gap, then we use what is called as a nerve graft. We take this nerve graft from the leg and then we graft it or place it in between the two ends of the nerve and repair it with very fine sutures. And we also use a glue, a type of fibrin glue to fix these nerve grafts. The other thing that we can do is nerve transfer. So if only the upper trunk or the lower trunk or only a part of the plexus involved, we can use some nerves from those areas and transfer it to the non-functioning area and give good results. We have done this quite a few times and have got very good results with this procedure. The other procedures that can be done include free functioning muscle transfer. That is, we take a muscle from the thigh along with blood circulation and nerve supply and connect all these in the elbow and shoulder to give back elbow flexion in cases of complete brachial plexus injuries. This is a long procedure, long tedious operation. It takes about 7 to 10 hours and the recovery time also is quite long. It takes about 3 to 9 months to see some sort of a recovery. After this, the patient, if whether managed surgically or non-surgically, requires a good amount of rehabilitation. And we must all understand that the nerve takes about and recovers quite slowly. It takes about 1 millimeter, grows about 1 millimeter per day. And you may not see recovery for a few months. It may take even 6 months to see some kind of recovery in case of nerve grafts or nerve transfers. So the patient and the doctor has to be patient and wait for the recovery. In the meantime, physical therapy has to be continuous so that the joints and the muscles don't become stiff. I hope this answers some of your queries. If you do have any doubts or any queries, please do get in touch with me. My name is Dr. Kanan Kumar. I'm a consultant hand surgeon from Spire Clinic, Bangalore. Thank you very much.